The Development Research and Project Center DRPC, with support from Saving Lives at Birth Partners, designed and implemented a project that built the capacity of the Muslim opinion leaders in northern Nigeria. These scholars were certified as master trainers on Islamic perspective on maternal and neonatal child health services by International Islamic Center for Population Studies and Research of the Al-Azhar University, and also the Training and Research Institute for Reproductive Health, both in Alexandria, Egypt. The Islamic scholars learned strategies to use in engaging healthcare providers on issues relating to Islamic perspective on routine immunization and maternal and neonatal child health services. The Islamic scholars have rolled out training for 334 healthcare providers, among which are 141 in service, while 193 are pre-service providers. One of the institutions that has benefited from this training is the Muslim Community School of Health Technology, Funtua. The principal, Malam Umar Imam, here testifies.
The organization, through its program coordinator, contacted us somewhere last year, and of course, they met us. We discussed on issues and areas that require intervention of the organization, particularly regarding the misconceptions about maternal and child health issues, immunization, etc.
The behavior of women and men accessing services, including health workers providing services in local communities in northern Nigeria, are affected by misperceptions and incorrect information about what is permitted or not permitted in Islam. An average health-seeking Muslim in northern Nigeria ostracizes and discourages others from accessing certain health services, such as hospital delivery, family planning, and immunization, on the ground that the services are un-Islamic. The intervention has gone a long way in changing perceptions, as mentioned here by a beneficiary.
I'm Habiba Abubakar Ayawa. I'm studying Health Information Management in Muslim Community School of Health Technology. I really benefited from the training because before I learned that we should not immunize our children because we are curing them. But I learned that immunization is not curing, it's prevention, not curing. So, and Islam permits us to prevent ourselves from diseases. So it permits us to immunize our children.
I'm one of the beneficiaries of the training that was conducted by DRC, and I know the time we participated, we have gained much out of the discussion. Among the things which were discussed during the training, that there are much or many misconceptions about the Islamic perspective based on the healthcare delivery, more especially in the issue of family planning and other issues.
This intervention has enabled the school management ensure that lecturers are sensitizing the students on the position of Islam on maternal and neonatal child health services.
We met, we discussed, and we agreed that if teachers will really be trained, particularly those teaching maternal and child health care, primary health care and other courses, because they will help in really training the students so that the students themselves can be able to as well impact positively by understanding the challenges and issues so that they can be able to create this awareness. So they came, they organized first one, the training on misconceptions about the maternal and child health care. Secondly, they came, they trained our teachers on how to teach those students on making clearer Islamic viewpoints on maternal and child health care in addition and other issues. And they also supported us in getting us reaching the National Primary Healthcare Development Agency to see that how they can as well help. During the training, they train about 10 of our teachers, and then they also did train 2 sets of students, the final year students of 2015. And they are now, most of them, in their various communities, serving, working, and utilizing the knowledge they were imparted.
Some of the students also stated what they have learned from the seminar organized by the Muslim opinion leaders and their experiences during industrial attachments in different facilities within the reach of the school.
In our community, they do not allow vaccinators to immunize their children, but now I know that immunization is not curing, it's preventing. It's one of the things that I know.
Our married men and women feel if they took their wives to the hospital, if it's no a lady died, there is no nurse there, they will not allow their wives to be treated by a male doctor. They feel the doctor will see the nakedness of their wife, whereby Islamically we are allowed to save lives. The doctors, their aim is just to save lives, they don't have any other intention.
As a result of this intervention, the healthcare providers have reached over 70,000 clients within 15 months.